Do you want to know everything there is to know about Medical Mutual's 4,000 HSA plan? Well, hey, your wish is about to come true, so stick around. How's it going, everybody? I'm Joey Gingola with Gingola Insurance, and today we're going to take a really deep dive on Medical Mutual's 4,000 HSA plan and tell you exactly what you need to know when you need the policy to work the most for you. So it's real simple. We're just going to go line by line. You might want to get a cup of coffee. I mean, we'll get through this. I know it's not the most exciting thing, but we're going to get through this because you're going to want to know how this thing works. And I have so many clients ask me over and over again, some of the same questions. So let's jump behind the computer right now as we're going to see, we've got two columns here. We've got, in-network and non-network. And then obviously on the far left side, we've got the benefit side, which is going to list exactly, what we're looking at and how it is covered. So first I want to, bring your attention to the in-network side. This is the side you're going to want to live in about 99.9% of the time. You have your non-network side over here, which is the side that you want to never live in if you can. Definitely very important. As you can see, the numbers, they're going to jump substantially from the in-network to the non-network. So let's pay attention to that. So we're looking at the MedMutual 4000 HSA, which is a health savings account plan. And it is a silver plan. You notice right at the top is our deductible. So that's where the plan actually gets its name. It's a 4,000 deductible. So it's a 4,000 single deductible, meaning if it's one person, you're only going to pay $4,000. If it's a family, you're going to have two $4,000 deductibles, totaling $8,000 for the family. So any combination of family members can meet that $8,000 deductible. And on the non-network side, you see things get a little more interesting where it goes from 4 to 12 and 8 to 24. So yeah, don't want to do that. The nice thing about this plan is that it's 0% coinsurance, which means once you meet those limits, those deductible limits, then you don't have to pay anything else for covered medical treatment throughout the course of the year. So in this case, the out-of-pocket maximum is going to be identical to your deductible, and that's $4,000 for the single, $8,000 for the family. Now, I explained it already when we were talking about the deductible, but the accumulation method, the fancy insurance word, is embedded. And that's nice. It probably doesn't mean a lot to you, but this is one big change Medical Mutual has made to all of their plans for 2016. They are all embedded, meaning they're split. So again, like we said, you're going to have two deductibles per family. So if only one person has, something going on that needs treatment and you hit the 4,000, you're going to stop paying sooner. Nice benefit there, and it's gonna make a big deal. I think it's something that is going to help you out a little bit if you do run into that scenario. And we already talked about it again. Coinsurance 0% is what you're going to pay in network. If you look across the pond there, 50% for the non-network benefits. So once you hit those deductibles on the non-network side, you're going to split the bills 50-50 until you hit I guess we didn't even cover the out-of-pocket max there. At $100,000 for the single, $200,000 for the family. They are staggering, but again, the circumstances in which you find yourself needing those are very rare and few and far between. They are possible, but don't look at them thinking that that's going to happen tomorrow. And then moving down here, overall annual benefit period max is going to be unlimited, basically meaning the insurance never runs out. You're going to have coverage for whatever you need. And $100,000 worth of medical bills, $200,000 worth of medical bills, not a problem. Once you pay your deductible, you're going to be taken care of, assuming it is a covered procedure. And dependent age limit, this has changed since last year. This is the first year that now in Ohio, we've rolled back to the federal age of 26. Before it was 28. And that's going to be at the end of the month in which they turn 26. So if you have a kid that's turning 26, they can stay on until the end of the month in which they are 26. So whatever their birthday month is, that's the month they're going to have to come off. And the benefit period, as it states right above the name of the plan up top, but the benefit period is going to run regardless of when you buy the plan, January 1st to December 31st. So that means your deductible and everything will reset after December 31st. Come the first of the year, you're going to have a whole new deductible to meet. So depending on timing and how things work out, that's something you're always going to want to be aware of as far as when you want to get something scheduled, when you don't want to get something scheduled, and when you're buying a plan, and so definitely something that you're going to want to pay attention to. Now we're going to get pretty repetitive here. Basically everything on this list now is going to be 0% after the deductible, meaning once you pay your $4,000 or $8,000 in network, you're not going to have to pay anything for covered medical services. So for the doctor's office visits here, it says physician office services. You have a primary care visit, a specialist and urgent care visits are all 0% after the deductible. Now, if you have never had a health savings account plan before, I will just let you know really quickly, and this is going to be true for anything else on this list, you're always going to pay the discounted rate that your insurance company has worked out with those in-network providers. So you're never just going to pay the full street amount. This is the benefit of your insurance working before you hit your deductible. This is something that I've had plenty of clients tell me that they are very happy with because it makes them feel like they're actually getting something for their money. In this case, if we're taking a primary doctor's visit, usually a primary doctor is going to charge you maybe $100 to go see them for something as mild as a sinus infection. Medical Mutual is going to get that bill and say, hey, doc, thanks for billing them $100, but guess what? We only let you charge them $50. So that $50 is going to be applied to your deductible, and that's basically the end of story. That's the negotiated or discounted rate. And that's how everything is going to work on this policy. There's always going to be a price the insurance company would bill you without insurance, and there's going to be the rate that your insurance company, in this case Medical Mutual, has already arranged for you, and then you're only ever going to pay that. So basically, you're going to see here, we're going to run through the list here. You're going to have to do that for mostly everything on here. So let's go ahead and get through this real quick. So moving down, preventative services. This is one of the only few exceptions that you have on here. If it is a preventative service that is covered under the, as you see, PPACA, or the Patient Protection and Affordable Care Act, or the Affordable Care Act, or Healthcare Reform, or Obamacare, they're all the exact same thing. They have about 8 different names. But if it is one of those preventative services, and it is in network, you're going to get that basically free of charge. When it says 0% and it doesn't say after deductible, means you're not going to pay anything for that, assuming the doctor has billed that procedure correctly, which is something that does actually happen more often than not when they don't bill it properly. So going to want to pay attention. And also notice if you jump over to the non-network side, it will be 50% after the deductible. So it's only for the in-network services is that covered free of charge. Very important to pay attention to. And then obviously we've got, a bunch of other preventative services that are not covered in the, PPACA, 0% after the deductible. So again, pay the $4,000, $8,000, whichever it is, and then it will be taken care of for you. You also notice here routine physical exams are going to be broken out specifically out of that preventative service for whatever reason. They're one of the big ones. That's one of the big preventative services that you're going to probably run into the most often. And then you have well child office visits up to age 21, again, free of charge. And you will notice that the pediatric vision is also tacked on right above that as well, I should mention. Then moving down here, we've got outpatient services. And this is anything that you aren't admitted to the hospital for that you're doing at, kind of a lab or, some type of freestanding facility like that. So you have allergy testing, cardiac rehabilitation, and note the number of visits that you're going to get per benefit period. So the cardiac rehabilitation, 36 visits per year. And again, benefit period means per calendar year. Chiropractic services, you can go once a month to the chiropractor. Diagnostic endoscopic services. So colonoscopy, all of that stuff. If they need to go look for something, if they need to go fishing, that's where it's going to fall here. You're going to pay to the deductible. Then once that's met, then it's going to be covered. Same thing with the lab. Now here's where it's going to get a little bit tricky. Emergency use of the emergency room and emergency physician and ancillary services are going to be 0% after the deductible, in network or not in network, so it doesn't matter. And then what's really important is that if you use the emergency room for not an emergency, it's not going to be covered, period. So you're not gonna want to do that. Just a heads up. Then we have mental health and substance abuse office visits. Again, all of this stuff, occupational and physical therapy, 40 visits a year. All of this stuff, pulmonary therapy, 20 visits a year. Speech therapy and rehabilitation, 20 visits per period. Again, surgery is a big one, so it's just a very simply listed surgery. That's where a majority of your costs are going to come. If you're having a big time, procedure done, surgery, 0% after the deductible. Again, it's all covered the exact same way. So as long as you're seeing what you need done listed here, it's going to work, exactly the way that we've kind of outlined. Let's scroll down to the next page here, and we're going to move to the inpatient services, which is again pretty boring. 0% after the deductible, you're going to see maternity, mental health and substance abuse, physical rehabilitation, you're going to have 60 days per benefit period, semi-private room and board, skilled nursing facility, you're going to have 90 days for that. And then again, inpatient surgery. So you have inpatient surgery, outpatient surgery, both covered. Again, 0% after the deductible. Very important. major things right there. So that's going to encompass a lot of different treatment. We also have additional services, so ambulance ride, durable medical equipment, home health services, 100 visits per year. You have hospice service covered, diagnostic imaging. So, again, MRIs, CT scans, all of that good stuff that you have a decent shot of maybe running into at some point, 100% after the deductible. Organ transplant, you're going to see you have an unrelated donor search. They're going to give you $30,000 maximum per transplant to find that person. Transportation, meals, and lodging, they're going to give you $10,000 max per transplant. So to actually get that person there, I guess, is what you're going to get. Private duty nursing for 90 days. Again, all of that stuff covered for the amount of visits and time, and it's 0% after the deductible. And the big one here, and everyone wants to say because you don't have a copay for your medication that you don't have prescription coverage. Prescription coverage is covered under every plan that you're going to buy. It's just a matter of how you're paying for it. In this case, again, it's in network only, as you can see, and what you're going to do is it's going to work exactly like that doctor's example that I gave you. Your prescription is going to cost a certain amount without health insurance. Medical Mutual has negotiated a different rate. You're going to pay that different rate. It's going to apply to your deductible, and that's the end of the story. Chances are, if you have a couple name brand prescription medications, this might not be the plan for you, but again, it's something to consider, and I can definitely help you make that determination, figure out if this is even a plan that you might want to be looking at a little bit later here, and I'll just talk about that in real quick. But wrapping up, again, pediatric dental has to be included if you have a kid under the age of 19 or 19 and under, so that's going to be there too. So that's it. There you go, a line-by-line breakdown of the HSA 4000 plan from Medical Mutual. So hopefully that gives you a much better idea of what you're considering, what you need to know. So the only question left that you really have to answer for yourself is if this plan is actually something that makes financial sense for you. If this is going to fit the actual type of health treatment you're expected to receive this year. Well, to find that out, I've got a pretty simple way to do that. Just click on my face right now, and that'll take us to that process and help us get started to do that. So again, click right here on my face to make that happen, or there is a link below in the video's description. But of course, I do appreciate you for taking the time to watch this video. It does mean a lot to me. And as always, I am Joey Giangola with Giangola Insurance. Take it easy, everybody.